guys have a huge problem. Hey guys, let me know if you can hear my mic is working. Let's see. If you can hear my mic, just type 1 in the chat so I know the mic is working. Okay, cool. Wow. I just have a feelings. I have a really strong urge that I have to come to life right now because you guys have a huge problem that make me literally raging right now. I'm looking at the comment and guys, there's a huge problem we have to really take care about today because I got hundreds of DM every day. They told me, "Hey, I'm taking med." So let me just read this message to you guys. This is from one of my follower, okay? I feel like my sensation in my body is overwhelming. There's like a lot of weird feelings. And he taking amitriptyline, gabapentin, pregabalin. So there's a lot of med that I even don't know how to read. And then he told me, hey, I have a lot of weird sensation. I feel my leg is tingling, my arm is warm, I feel my nervous system is regulated. If you're taking so many medication, that's why. For people, if you're having brain fog, ADHD, or like different kind of neurological challenge, they are all coming from one reasons and one source, which is your nervous system and your brain. All your feelings, how you interact with the world is determined by how well your brain is performing. If you imagine, so your brain works really simple. It's just like a computer. When you press the task control on your computer, you can see how many percentage it is actually running. If they are running low, so every time if you feel your computer is glitching, is slowing down, is blue screen, you open this task manager, you will see that the computer usage has been exceeding its limit. So this is what happening in people with brain fog. Their brain literally slow down so that the feelings is getting weird. They will feel overwhelmed, they will feel dizzy. Mostly they describe the ADHD like symptoms because their brain simply do not have the resources to do the things they are asked to do. And it is not the fault of you guys. You're not born with it. It all happened because you train your nervous system and train your brain to become ADHD. For example, you take all the medication just trying to fix the symptoms. Most medication, especially for the medication for the brain, for the nervous system, they are mostly suppressive. Some of them are activating, but your brain chemical is so complex. You cannot just attempt to use one chemical to restore the balance of the brain. And most of the medication are going to make the condition worse. So that's why this person messaged me and she take one medication at the beginning and then she's now taking 5. And the symptoms seems getting worse and asked me what I can do. Come on, you have to really think one step behind. Why do you need to take so many medication? The medication only masks your symptoms. It never, 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 ever, ever will heal you. I'm a strong believer of that. When I was young, in the same shoes with you guys, I take antidepressant because I'm just feeling unhappy and ADHD like. And the doctor prescribed me a antidepressant. And the doctor who claimed that can cure you or have a lot of evidence show that is not that true. They're using their limited understanding and try to have a quick fix for you guys so you're not going to see them again. Research show that medication for ADHD or for depression, the effectiveness only has 50%. So it's a miss or hit. And why is that? Because it's never going to fix you. The issue is not in the chemical. It's about how your brain are able to activate. So I want you to listen really carefully. And this is the reasons why your brain stopped working. In your brain, there's a lot of brain cell. How well your brain operates is determined by how well those brain cell is firing. There's trillion of brain cell firing it at the same times and they're communicating to each other. If they're not firing well, the connection getting loose, your brain just getting slow. So brain fog would happen. And this is it is really simple. And depends on which brain area, like which brain area here get misfire. Different symptoms comes up. If you have a frontal lobe issue, ADHD, personality change, emotional feel overwhelming, classic ADHD or autism, or like you guys call the neurodivergence. The second thing is if you have a lower part brain activation, like lower part, like the brainstem, the cerebellum, you have dysautonomia, like literally dysregulation of your nervous system. And what do your lower part of the brain do? It control all the function that keep you alive. Your heart rate, is your heart pumping? Are you able to breathe correctly? How well your eye control your pupil? So heart rate, blood pressure, digestion, your vagus nerve, your stress and digest, your heart rate. So people have a brainstem dysregulation. They have POT. They have air hunger. They have like that fear coming out from nowhere. They feel their eye is dry. When they look at the screen, they can't focus. When they go to a place that overwhelm, go to a place with a lot of things moving, like with a lot of people, they feel overwhelmed because their eye is not moving well. It's the foundational function of your brain. So depends on which brain area is not activated well, you have different symptoms. And let's check some of the comment here because like I was just like people, I'm not sure if you're listening, you're in big trouble if you're relying on medication and if you're just procrastinating and not doing the things to turn your brain back on because you're having a bigger problem than me, my friend. Let's see if there's any comment or questions that I see my DM that I should be really, really be answering. Okay, this is a good question. So, I got a message asking me, hey, how your therapy looks like and how much is a session. So first, you guys has been brainwashed by medical industry right now. Today, medical world is one of that dictated the world. They're not dominating the world. They're dictating the world how health should be developed. But Einstein and I believe it's Thomas Edison, the guy who invented the light bulb, said the doctor, the greatest doctor, and the doctors in the future should not be prescribing medication. They should be helping people how to heal. Because one of the interesting history about medical group is medicine is their original philosophy of curing people is based on a theory called the allopathic approach, which means if something causing you sick, you remove it and then you get healed. So at the beginning, they cure disease like infection. If you get injured, you do surgery. But for some reasons, because of the pharmaceutical industry, because of all the profit, they have to the drug changing from hey, it's curing infection to managing symptoms this day. If you have to take that medication for the rest of your life, probably that medication is only covering your symptoms. Medical doctor is good only in saving people's life and curing something that is infected by a pathogen. But people, you guys have a brain fog and ADHD is never a disease. It's coming from inside you, your brain, and your body is not functioning correctly. They're dysregulated. They're not activating. So if you use a medication, there's no pathogen there, there's no bacteria there, there's no virus there. So what kind of medication you should take? There's no medication. So stop, imagine you can take medication to solve this. The things I see the most is people take one medication and then they end up taking 10 or 5. Anyway, yeah, okay, let's talk about the treatment. So my point is the treatment is not medication. 100%, 1000% sure. We have to find a way which part of your brain is not working, is not activating. Some people frontal lobe, some people lower part, some people brainstem, some people different kinds of area. And then we find a way to rehab your brain, to reactivate it. It's like physiotherapy. It's like workout. You do a specific brain exercise or brain protocol to activate that part of the brain. In neuroscience, we have a research show that. So, in neuroscience, there's something called the neuroplasticity. The brain cell can actually rewire. What do rewire means is it's just like your muscle. Your brain is like muscle. The harder you work it, the more you use it, it gets bigger. It's the same thing as your muscle. So that when you do one thing more and more, you can change your brain and activate your brain. But on the flip side, you can train your brain to have brain fog and ADHD, which is you do the one things and you don't do anything, just lay on the bed, scrolling phone, scrolling social media like you're doing right now. So don't scroll too much. You're training your brain to get lazy. A research showed that, I believe a few years ago, they found that when people scrolling, especially up and down, their frontal lobe shut down. So every time you scroll the phone, you're training your brain to shut down. There's one interesting exercise you can do if you don't believe me. So I want you to, maybe this is hard because you're watching my life. I want you to close your eye and just imagine holding your phone and imagine you're scrolling up, that flicking finger motion. Just imagine you're flicking it, but close your eye. When you do that motion, you will notice your eye is moving, even though you're not looking anything. Try this right now, or just swipe. People who swipe on dating apps, maybe they swipe right to left. When you swipe, your eye would automatically move, even though you close your eye. So try this right now. Type, let me know in the comment. Do you feel your eye move when you just move your finger? Do this right now. Okay. And he said, yeah, the eye move. Why? This crazy, right? You're not looking anything. You are, you're just with your brain just wired the motion when you scroll, your eye move. So when you scroll, your brain, so you're, let's do it again. So you already, if your eye move, you already train your brain to associate scrolling, eye movement, finger movement, and shut down your brain, all four things together. So that's why, even though you are not looking anything, you just do that motion, your eye would move because you probably do it 1,000 times. So this is negative plasticity. You're training your brain. Every time you scroll, your eye move, and your brain would automatically shut down a little bit. Our research actually showed that when people scrolling, their frontal lobe, the blood flow to the brain decrease. So that's why people, every time they scroll, they cannot stop scrolling because when your brain shut down that a little bit, you lose the ability to control yourself, the frontal lobe. So that's where the procrastinations come, the ADHD come, the decrease in cognition and memories come. And there's also one more thing. I'm not sure if you guys notice. When you scroll on media, people always say, hey, comment these things or follow me. When you say, when you will follow people to comment, right? You will follow what I told you in a video without even think. Notice that next time. You don't even think. Why should I listen to what I say? Because when you scroll, your frontal lobe shut down. You just do what people told you to do. And this is crazy. People using this psychological trick is not psychological. It's not psychological trick. It's a neuroscience that force you to do something you don't want when you scroll the phone. So that's kind of dangerous. Okay, so let's get back to the topic. How do you rewire your brain? So this is negative plasticity. So you do 1,000 times every day. Now you wire your brain to negativity. So we have to do the opposite way. How do we wire our brain to positivity? If you see a lot of like nervous system regulation guru online, they will tell you, hey, positive mindset, you have to think, blah, blah, blah. But for me, I do something deeper. I will teach you how you can do just a motion. You don't have to even think to create positive plasticity. When you do one thing correctly more and more, you can change your brain. And in neuroscience, we know that you only need 5 days to change a habit, to change something, but you need 15 days to make it permanent. So if you do something correctly for 5 days, you see change. If you do it for 15 days, you will permanently rewire your brain. And the treatment is simple, just do exercise. But there's a lot of specific exercise, depends on what you need. So back to the comment, what is the therapy looks like? And how many session? How much is a session? So it's not a session. I think medical industry has brainwashed you. You want quick fix. Nothing would fix in one session. You will feel difference, but never nothing going to change. You need consistent at least 5 days, minimum 5 days, ideally 15 days to rewire your brain, to get rid of the ADHD. Yesterday I got a call with a client. He asked me, hey, how much he having some kind of doubt about how much people I actually help. And I think about that yesterday. I already see like in the past 2 years, I see more than like 500 kids, and every one of them I spend at least 30 minutes to assess their brain and their situation. And quite interestingly, find out people who have ADHD, attention deficit, like you bump into things, balance issue. They all have a brain activation problem. They have a brain imbalance. One part of the brain is not developed well. So that's why you guys have symptoms. And my vision is to share with you guys the framework and just help the whole world. But anyway, I need your help. Um, if any one of you have some special talents, maybe you're really good at marketing, you're good at video editing, you just want to help me answer comments, maybe join my community group, the Resilient Brain Academy, the Brain Fog Academy, to just help me organize the event, manage the group. If you're interested in doing something like that, let me know. And in return, I would fix your brain as well. So let me know if you have any special talent. Okay, someone said my volume is low. Let me know if the volume is a little bit better, because this mic I already set to the maximum. Even though I'm literally saying loud, it's still pretty low. Let me see. Maybe, how about right now? Okay, check. Is the audio here okay right now? Would it crack if I raise it too loud? So if the, okay, it's better right now. Okay, cool. Okay, so let's see. What should I do to first solve my brain fog problem? This is a question that make me rage sometimes when I see you guys comment, hey, should I take medication? I'm taking medication. So when you guys DM me, I always ask, what is your struggle? What have you tried? And when I ask it, I feel really angry and upset, because most of the question I got is, I'm taking 5 medication, I'm doing nothing, I do not exercise, I do not watch my diet. So before you do anything of my brain exercise protocol, please, please, please look at your lifestyle. I think this is the best advice I can give you, every one of you here right now, because sleeping, exercise, diet, and mindset probably can already fix 50% of your issue right now. And let me go through one by one, but let me put down something here. So brain exercise protocol plus lifestyle change, like your sleep, your diet, your hydration, your nutrition, your mindset, and exercise. So I put it in a comment here. By the way, I'm also streaming on Facebook, so I'm maybe I will miss some comment. Okay. So before we do anything, as I mentioned earlier before, the medical maybe it's not their fault. It's just for the industry starting with the big P and our mindset and this and on the internet, people are looking for quick fix. They're looking for medication. I have a huge book. It's called Home First Aid book or something. So literally at the first page of the book said the first line of any medical treatment, the first line of treating any disease like high blood pressure, ADHD, diabetes. Can you guys, what would be the first line of treatment? Can you type it in the comment? Let me know. You will be surprised the difference between the first line treatment 20 years ago compared to this day. So for the first line treatment 20 years ago, in the textbook, it literally said lifestyle modification. That means sleep, exercise, diet, hydration, mindset. But today, if you go to a doctor, the first line of management is medication. I give you a pill, you go back home, and then okay, come back later, and probably you see them again next month. Because I don't know what happened, maybe the money or how they educate in the medical school this day. So the first line is always modify your lifestyle. So let's go through just one by one and then we will end the call. Just keep it short because I know it's getting late. So lifestyle. Where's my comment here? Okay, I got it. So lifestyle modification. So look at how, and I need to add one more thing, is your phone. How many screen time do you have if you have brain fog? If you have more than 1 hour, so go to your iPhone right now, go to the setting. So if you go to the setting here, let's do it together. I'm going to show you mine here. Just, I believe if you type screen time, so if your screen time is more than, let's say, 2 hours, I want you to lessen it first, because when you scroll, you're shutting your brain down. I mean, if you screen time on social media, then you have to stop. And let me show you mine. My screen time daily average is 3 hours and 50 minutes. I'm not hiding anything, but because I work a lot of with online client with you guys, so it's okay, it's normal. But let's look for the screen time of the social media. Let's see Instagram. How do I see the Instagram screen time? Can I see that? Screen time. So go check right now your screen time of TikTok, Facebook, and Instagram. If you have more than 1 hour, probably you know where's the issue. You have to reduce it. anyone know how to check the screen time? I'm still looking at it. Screen time. So anyway, for me, um, yep, I can't find it. So just ask yourself, how many time did you spend on TikTok, Instagram, maybe Webnote? Webnote is getting popular this day. How many time do you spend? And TikTok is the worst. TikTok is more for entertainment. They do all the stupid things that probably make you make you become even more stupid. So limit to 1 hour per day. Who is? Let me see. Okay, the next thing is diet. How many of you are from USA? Type USA down there if you're from the US. In US, diet has been worse. I used to live in US for 6 years, and right now I relocated to Hong Kong. When I was in the state, even though they have a lot of beautiful weather, the food looks pretty clean, looks pretty vibrant, colorful. But for some reasons, they have the most contaminated food chain in the whole world. The water is contaminated, the vegetable get contaminated, the egg get contaminated, the meat get contaminated. So even though I would eat pretty clean, I still get diarrhea or I still get some kind of GI upset. So if you are living in the state, not just living in the state, make sure you look at your diet. Are you eating clean? Clean means not necessarily no fried things, not necessarily mean you cannot have steak, you cannot have like sweet. Good diet means do you have balance and what kind of oil do you use? Do you eat a lot of processing food? If you eat a lot of things, just open a package and you can eat, probably not good. And for oil, if you're using canola oil, peanut oil, seed oil, rapeseed oil, there's a big no-no, especially the oil used in McDonald's. I believe Chick-fil-A used that as well. Anything that oil that I just mentioned is bad. They are highly inflammatory to your whole body. Imagine if your brain is inflamed, your brain cell is inflamed, your brain cell cannot work hard, then you have brain fog. It's really simple. By the way, I just get a hydrogen water bottle. I'm not selling this. I'm not helping them to sell. I paid for my own money. It's hydrogen water. It's called Echo Water. They infuse hydrogen there. Hydrogen in the water is highly anti-inflammation, so it would absorb all the free radical in your body, and then it would mitigate those kind of inflammation in your body. And I drink this for just 1 month, not just 1 month. I drink it for 5 days. I already feel I have more energy, more clarity, and I have less craving for alcohol. So you guys can try it out, and I have been keep drinking it every day. So that's pretty good. And now I feel so good. I don't want to lose that feelings as well. So diet is something you should be checking out. I have a call last week. There's a client. She is from Filipino living in Canada, and she said, "Oh, she speak really slow like this, and she is only 60s, and her sounds, her voice is so tremor and hoarseness. That is a classic sign of brain getting worse. It's probably degenerating in somehow, but she's only 60. And I asked her, hey, what do you feel like you need the most help? And then I asked her, hey, what did she eat? And find out she eat a lot of oily stuff, fried things, sweet things, and no wonder why she would have that kind of condition that early. So if you're having brain fog, just change your diet, please, first. So cheese, dairy, gluten, you should stop. There's a lot of things you can do. Um, Also supplement. You can take vitamin DK. Vitamin D3 plus K2. You can take minimum 10,000 IUs per day. Minimum. You can take up to 20,000 to 50,000, but that's only for reference. So make sure you pay attention for your condition. Also, you can try magnesium glycinate for 400 mg every night before bed. It will help your sleep, help your nervous system as well. So just take these two. You can also try omega-3 oil. Make sure you get some good quality. Good quality means not the things you buy in Walmart or Costco. Probably is not good. There's a brand called the Nordic Natural. It's on Amazon. It's like $50 for a lot of pill. So you can try that. Because your brain is, the brain cell is made from fat. Eating good fat is good, just no canola oil. Take omega-3 oil, avocado oil, animal oil like butter, geese oil, that's good. Avocado oil is the best, and omega-3 oil, because your brain cell, literally is made from fat. If you cut out too much fat, some people may feel tingling in their hand because their brain cell may be degenerating. The nervous system, the nerve is demyelinating. This is real, so make sure you have good health, good fat absorption, and vitamin B as well. So this diet, this is already too much you can do. And hydration. How many of you, so I'm not going to ask you type it here. For people that's weigh at least 60 kg, if you search online, they will tell you to take 2 liters of water. 2 liters is minimum. Ideally, 60 kg, you want to take around 1 gallon, which is around 3.7 or 4 liters of water. Because if your brain don't have enough water, your cognitions go down, the blood goes down. There's a research show that, I don't really remember the exact number. They find out that if you just dehydrate by 20%, your cognition, your thinking will slow down by 30%. So by just drinking water, it already help a lot. So everything's count. You change one things at a time. Maybe you drink water, improve 10%. You fix your diet 10%. You sleep 8 hours, 10%. So it's already helped you a lot. And then the next thing is exercise. You guys, you have to exercise. If you're still sitting too much, make sure you at least do 1 hour of exercise, maybe 2 times a week. It's not that hard. Just go for a walk. And for the brain, weight training, like lifting weight. Lifting weight is important. So what kind of exercise is good is research find out core exercise. Core, train your core, and leg press, weight training about your leg is going to has the biggest stimulation to your brain. And they also find out when you do leg press, pick the heaviest weight you can withstand. They find out when people dip squat really high weight, like heavy weight, they find out that the brain would actually produce a chemical called the BDNF, brain derived neurotrophic factor, which means it's a good stuff to help your brain to change. So this is the neuroplasticity I mentioned earlier. So when you do weight training, you literally are going to feel happier. And also another research showed that, do you know what's the greatest cure for depression? Is exercise. Do you know why? This is neuroscience. And this is how I help people activate their brain. So in your joint, so this is the key point. If you can understand this, you will fix your brain fog. It's a concept. You have to find a way to provide good stimulation to your brain. This is the key. This is the only things you need to know. But how? In your spine, in your joint, there's a lot of nerve ending. Every time you move it, it is sending signal to the brain to activate it. So if you can feel it, if you can feel you're touching your hand, you're moving because your brain has feelings. The feelings, the stimulation come from the hand. The brain area light up. So every time you use something, you're rewiring your brain. So how does it do with exercise? In your spine, especially lower limb and nearby your spine, every time you dip squat, you're stretching those nerve ending. You're stretching and giving stimulation generating from those joints so that the brain activating. So that how you can change your brain. And this is a bonus question for you. Do you know which kind of therapy has the greatest stimulation to the brain? Type your answer down below, and probably you won't believe me, but type your answer below. Do you know what kind of therapy would change the brain the most? And you won't believe it. It is a chiropractic adjustment. Wait. I know what you guys thinking. Is it a is it a back cracking chiropractor? No. Cracking bone, that bone setter. Chiropractor, if you go to a nervous system based chiropractor, they would find out which joint is misaligned, because if that joint is misaligned, which means every time you move that joint, it is creating bad signal to your brain. And then research show that in research you would never see the word chiropractic because it's pretty stigmatized, and they use a word called high velocity, low amplitude therapy. It's called HLVA. They found that in the joint, there's something called the GTO, the Golgi tendon organ. Every time they stretch those joints using a specific method at a really high speed, your brain would light up. They put that person in the brain MRI, the functional MRI. They found that when they stretch and stimulate someone's joint in the spine, certain brain area light up. And when the brain light up, it didn't just light up for a minute. It will first light up for a few hours, and then it will stop. But then what interesting is happen next? They do a pre and post brain scan, and then they found that people that having a specific chiropractic adjustment, 1 week later, their whole brains light up, their brain activity increase. So that's why for some people that see a chiropractor who know the real chiropractor, that they know what they're doing, people would feel happier. They will feel the world is getting brighter. By the way, this is some secret I never share on online. I used to have brain fog until I'm 20. So right now I'm 30-ish. So when I was before 20, I'm brain fog. I feel dizziness the whole day. Every time I wake up, I feel brain fog. I feel dizzy. I feel I am floating. But then for just a random reasons, because I have back pain, I go to see a chiropractor. And in 10 times, something really interesting happened. There's a moment I can think clearly. And I think, that's weird. And then I asked my chiropractor, oh, is it related? And then he say, yeah, it's related because it's regulating your nervous system. And then at that time, I was a nurse working in a hospital, and I was thinking, really? It's because it seems quite irrelevant, brain fog and cracking the spine. But anyway, I see longer care in chiropractic. I believe like until I got 20 spinal adjustment, I just feel my brain is so sharp. I feel so sharp even though I go to study chiropractic in the state. And then I graduate the top of my class because I simply get rid of my brain fog. So, and personally, I just use stimulation on the spine using an instrument. And I already help like few hundreds of kids get rid of their ADHD just by stimulating their spine. And some people will ask me, hey, what would be the successful rate looks like? And after I treat like few hundreds, I can only think about 5 cases is not responding because they have like nutrition issue. Otherwise, they all get improved or cured by the standard this day. What instruments should I use? So there is a medical equipment, so that's not something can be purchased by you guys. So it's a therapy, it's a type of medical service. So anyway, so let's get back to what kind of things you guys can do, because I told you if you understand these things, you would cure your brain fog and ADHD and other neurological symptoms. Because we know certain part of your brain. For example, if I move my finger on my right side, I know it would go to my left brain. The opposite side, it would bypass. It would pass through certain brain area before it reach my brain. So if I know which part of the brain is not working, and I do certain motion, then I would activate those part of the brain. For example, I can use vibration. I can use complex movement. I can use light. I can use electricity. There's hundreds of ways to activate your brain. It just depends on what you need and which one works for you. And before I end the call today, I want to give you guys one tips you can take away for today is, so first is make sure you look at your sleep, diet, hydration, nutrition, mindset, and exercise. And another things that I can homework for you guys is try to start rewiring your cerebellum. Your cerebellum, no one really talk about that. They always talk about the frontal lobe. But for your frontal lobe to work, your cerebellum has to work together because it's connected. I saw a medical doctor. He is famous on YouTube. He share, hey, why ADHD people, brain fog people always bump into things when they walk. How many of you here would bump into things when walk? Maybe we will bump the doorknob. We'll bump into people. You would drop your phone, things like that. Type me down there, so I would know. And then the medical doctor literally find a research to say that, hey, they put 30 people with ADHD in a literally brain scan, and then they all find out they have some issue in their cerebellum. And I was thinking, oh, okay, cool. This medical doctor finally get into something. This something is something we know it for a whole damn time, but medical society just don't see it as an issue because they don't know how to fix it, so they're not going to talk about it. So the research only show that people with ADHD brain fog, they have a imbalance in the cerebellum. And what do the cerebellum do is help you coordinate everything in your body. It help your balance, make sure you don't bump into things, and also coordinate the blood flow to your brain and coordinate how all brain area is doing. So if the cerebellum is not doing, probably the whole brain don't work, or it will just work to a certain extent. So no wonder why you have brain fog. So let's cut to the chase. How do we do it? We just have to find a way to activate the cerebellum. And since we know, so this is the things I'm going to say worth at least $100,000. So you want to pay attention. If we know the cerebellum is so important, so we have to find a way to activate it. But let's think about when would this cerebellum activate? And what do the cerebellums do? It like complex movement. It like new things. It like something require high level of fine skill. For example, making puzzle, making model, learning new things, go to a new restaurant, maybe driving, taking a new route. So your cerebellum love those things. That means every time you do the things I just mentioned, your cerebellum will work harder. The harder you challenge your cerebellum, the harder it get activate. When it activate more, you remember 5 days to make a change. So you do hard things and new things. Something require your balance and fine skill for 5 days. You change your cerebellum. You do it 15 days, you totally make it permanent. So that's how you rewire your cerebellum. I have a client, she's a paying client right now. She just used one of the free advice in my video. If you remember, I have a figure of 8 motion, the figure of 8. She just do it for, I believe, 1 day. If I'm not remembering it wrong, 1 to 3 days. She is no longer bumping into things, and she feel her mind starting clear in just 1 to 3 days by doing one exercise, that one complex motion. So it is doable if you do it right. So if you want the video, it should be somewhere down below. So this tips worth at least $100,000. I learned this after I spent over 300,000 and 6 years in learning neuroscience. So this is the tips. If you understand, it will work. If you don't understand, that's fine. I challenge you guys tomorrow. Just get a piece of paper out right now. I know it's getting late. Get a piece of paper. Just write down one thing. What is something you would do that you haven't done before tomorrow? It could be, oh, I'm going to go to try a new restaurant tomorrow. Or I'm going to order something unusual for my lunch or for my dinner. Or just find something that requiring some skill tomorrow. Maybe just practicing your handwriting, that will work as well. Just write down in a paper right now, or drop it in a comment. Let me know what you would do tomorrow. So for me, I'm going to a TED Talk after this live. So I'm going to meet new people, new conversation, so that my cerebellum would activate. This is what I would do. La la mila. If I learn new things for 5 days, it would change. Yes, you have to learn it in the right way. For 5 days straight, you will start seeing change. For Where dog thrive. I will write with my non-dominant hand. Non-dominant hand. That might be a little bit hard. You can just do like a complex. You can just do a figure of eight motion that would do the work. Just use it on the non-dominant hand. And for photo speed BBK, can you help people dealing with disconnection, depersonalization? Yes, I have helped people like that. I believe I helped like 3 to 4. Just quick reply, just quick idea. Why people get disconnection is their brain connection is getting low. Their brain is activating low. It's the same condition that I just mentioned, but it is in a brain area called the parietal lobe. Search. You can search somatotopic mapping, Google. Oh, wait, I have a map here. So in your brain, different brain area have a body mapping on your body. It's like a Google map. If your brain lose your Google map, it would get lost. It would go random places. So it would tell you where's your hand, where's your face, where's your body, and where is your organ. So when people have depersonalization, they will feel like, oh, some people more severe, they would feel like I'm grabbing my cup from outside of my body, or they would describe, oh, I'm holding the cup, but I don't feel like that's my hand because their Google map is lost. They can still move their hand, but they feel like, oh, I don't know what this is. This is a more severe case. Some people will just simply feel, oh, I feel I'm moving, but I'm not. So there's a different presentation. So same things is a brain activation problem. Okay, so let me check the comment on Facebook and let's call it for the day. Oh, someone said, oh, waters only. I drink protein drinks. Make sure that 4 liters is good water and you can add some salt, Celtic salt, because it helps your body absorb it. One of the things you have to think about, so this is for Deanna. It is always not about what you eat or what you drink. It's about how well you can absorb it. If your gut is not okay, it doesn't matter how much you drink. So make sure you drink good water, add some salt. It might help. Protein shake help, but don't only drink protein drink because there's a lot of sugar for some protein drink. And make sure, is it a whey protein? Do they have gluten? Some people have leaky gut. When they drink protein, it makes the things worse. So make sure drink quality protein drink. If you can get it for, what's that called? There's a brand, it's called Golden Nutrition. Like you can the GMC. You might have to watch out for that if you don't buy a quality one. Because I used to drink protein shake and then I got diarrhea every day. But then once I stop, I'm fine. Or I change to maybe amino acid. That also help because it's bypass the digestion. Feels like you're in the outer space. Yes, because your Google map is off. So for Michelle. Oh, Michelle is here. Okay, we talked before in the call. Yeah, it feels like. So Michelle, for you, we go through your situation during the call. So another things you should be trying is your diet. That 5 things: sleep, diet, mindset, hydration. Maybe that's something that you have been missing. You have to fortify your foundation before your brain to rewire. Your brain need to have the enough rest and enough building block to rewire. It's just like building a new building. If you don't have any material, if the wall is like dirt wall, your building can only build so tall. Okay, so that pretty much for today. And how long have we been streamed? Do we have a timer here? Oh, 1 hour. Okay, that's longer than I'm expected. So probably we will stream again next week, and I will make an announcement and collect some questions beforehand. Okay, stay safe, guys. And if you're interested to work one-on-one with me, you can DM me, help or focus, and then my team will reach out and see if you're a good fit. Currently, I have a pretty promising program to help, especially business owner, entrepreneur, or people who have struggling in work performance or different kind of neurological disorder works as well. But right now, our focus for more people that are ready and in a better state to invest in their health right now. And we're so confident, we even have a money back guarantee to you guys if it didn't work. So confident it will work. So if you want to just get information, DM us and you can book a call with me and see if we are a good fit. Okay, see you guys. Dr. Pangs out.